welcome to the show where we share the stories of the many who intersect with our healthcare system but are rarely heard from. My name is Kevin Poe, founder and editor of KevinMD. Rate and review the show at kevinmd.com/rate. Subscribe at kevinmd.com/follow. Today, we welcome back on the show Rich Parker. He's an internal medicine physician. His latest KevinMD article is titled, "The New 988 Hotline Has Potential to Transform Mental Health Care, but Challenges Loom." Rich, welcome back to the show.
Thanks, Kevin. Great to be here again.
So we'll get to the article in a little bit, but for those who didn't get a chance to listen to our first episode together, just briefly share your story and journey to where you are today.
Sure. So my father was a psychologist, and when I went to med school, I was always interested in psychiatry, but I went into internal medicine. And then practicing internal medicine, I quickly realized that a high percentage of patients that I saw in the office had behavioral health concerns. A lot of anxiety, depression. I saw my share of personality disorders, schizophrenia, bipolar illness. And then fast forward, our own family had a psychiatric emergency a few years ago. Fortunately, all worked out well, but I actually had to call the police to come to our house to intervene. It was scary, and a lot of families have experienced this. As a result of that, I became involved with NAMI. For those who don't know, NAMI, N-A-M-I, is National Alliance on Mental Illness. And it's a volunteer group. Every state has chapters, and I serve as a family support group facilitator. We have Zoom groups for families who have a loved one with severe mental illness. And we see a tremendous lack of adequate mental health services in the US. And at least this is some way to try to address that.
All right. And before we get into the article, just give some background and context. What is the National 988 Hotline?
For a long time, it's been understood that the system of emergency care in the United States is very patchwork. There are a lot of holes, a lot of gaps. There's something called the National Suicide Prevention Lifeline, which has been around for a long time. And actually, I'll just take the opportunity to share that phone number with any listeners who might be having thoughts of suicide. That number is 1-800-273-8255, 800-273-TALK. However, Congress realized that they needed to do better. So legislation has been passed to create a national hotline for behavioral health, for mental health, and that number is 988. So instead of having to dial that 10-digit number I just gave you, there's a 3-digit number. This legislation is operative in all 50 states starting this month. And it's funded with $282 million, which might sound like a lot of money to some people, but for a national endeavor, it's really not a lot of money. And this has to be funded by each individual state. So they've got to hire people for the phones. They've got to get the information technology together. There's a huge amount of work to do for each state to get ready for the mandated start of 988 this month.
So according to the plan, if someone dials 988, what happens next? Who picks up on the other end?
Right. So depending upon how organized their state has been, hopefully someone in their state will pick up within 10 seconds. We've been assured that if states have fallen behind, there are ways that these calls will get routed literally to other states where there are more operators with mental health training. So calls will be answered, but it remains to be seen whether calls will be answered immediately. And that actually will be part of the data challenge to track how well 988 is doing in every state.
All right. And you talk more about the challenges in your KevinMD article. It's titled, "The New 988 Hotline Has Potential to Transform Mental Health Care, but Challenges Loom." So as you summarize the article, how does it have the potential to transform healthcare, and certainly talk about some of those challenges?
Sure. Well, the challenges are pretty big. So just by way of context, right now in the US, there are over 100,000 drug overdose deaths per year. There are almost 50,000 suicide deaths per year. And there are more than 1 million suicide attempts per year. So just to give your listeners an idea of the magnitude of the problem in mental health is really huge. So there's a lot of room for improvement. So that's the bad news. The good news is we're working on it. So 988 is not a panacea. It's not going to solve everything by a long shot. It's not going to create more social workers or psychiatrists or psychologists, but at least it's the beginning of a system to try to put a safety net under people who are in a crisis and are literally calling out for help.
And is this going to replace the suicide hotline that you mentioned earlier, or is it going to be working concurrently with it?
My understanding is it will work concurrently. So they would never want to turn off a phone number that people think someone's going to pick up. But the goal is that 988 over time will be the national system.
In terms of, in an ideal world, let's say there was enough funding and staffing, give me the ideal situation of how this is actually going to transform mental health care.
Right. So great question. Ideally, in the perfect world, we wouldn't just be talking about a 988 telephone number, which is a little bit of a flimsy safety net. We'd be talking about adequate mental health services for children, for teenagers, for adults, for elders in every state, in every county. And really, we just have a tremendous shortage of behavioral health. And that is a systemic problem that relates to the way healthcare is funded in the United States. And you and I know that people that go into behavioral health are the lowest paid people in the provider world. So the market speaks and we don't have enough of them. On top of that, we have more stress than ever. We have a pandemic, we have economic inequality, we have all sorts of insecurity about in the land. So there's more stress, more need for behavioral health at a time that we just have a tremendous shortage of people to provide it.
What would be a typical scenario of someone who will call one of these hotline numbers?
Sure. So often it's someone who's really desperate and they haven't been able to get help from their family, their friends, their own doctor. Maybe they've been afraid to reach out for a variety of reasons. Maybe they feel humiliated. Maybe they feel stigmatized and they feel desperate to some degree. And they are afraid that they might hurt themselves or maybe hurt someone else. And so they call. And when they call, that call will be answered by someone with some behavioral health, mental health training, who will be calm, who will be caring, who will be thoughtful, who will be able to take a quick, good history of that patient and find out if they are in imminent danger of harm. And these people are trained to know that if they think the person is in imminent danger, they will actually call 911 if they have to do it. They don't like to do that because obviously the person calling did not want to call 911 because that's a whole other set of problems that when 911 is called, usually the police respond who may not have adequate behavioral health training. And we know the consequences of that can be poor or even deadly. So the person takes the call, they will talk with the person as long as necessary. If the person is not in imminent danger, then the person on the phone will offer them some advice about where they can get some help, get resources. I'm sure they could direct them to NAMI, and hopefully they have some understanding of that person's local geography and behavioral health resources. So they'll start to hook them up. So the 988 operator is not personally going to be the therapist. They're going to make sure the person is safe, and then they're going to try to connect that person with local resources to help them move forward.
Now, given your background in the mental health space and the limitations and challenges that you articulated in your article and in this interview, what do you envision the path forward to be for this new hotline?
I think it's going to be very interesting to see how this rolls out. Hopefully not a huge number of bumps. Hopefully there'll be a smooth transition in most states. Personally, as the chief medical officer for a data aggregation and analytics company, I'm very interested to see how the data gets aggregated and how 988 nationally starts to measure its results. And hopefully they'll be transparent about reporting those results so we can all learn something pretty quickly. So it's going to be one of these iterative processes where it's going to start, there'll be bumps, and we'll fix and we'll make better. And hopefully we'll use aggregated data and analytics to understand where are the places we can fix it most quickly.
We're talking to Rich Parker. He's an internal medicine physician. His latest KevinMD article is titled, "The New 988 Hotline Has Potential to Transform Mental Health Care, but Challenges Loom." Rich, so in my primary care office, if I wanted to share the 988 number with one of my patients, what's the scope of the services that they provide? Just to give me a sense of what kind of patients I could share this number with.
Right. I would back that up one step and say the first thing is making the public aware of 988. I actually heard this on the radio this morning, a discussion on NPR of 988, and I was really happy to hear it. So hopefully there'll be public service announcements, but I would hope that your healthcare system and your listeners' healthcare systems will advertise 988, put up a flyer in your waiting rooms, 988, mental health call available. We have to start to make this widely known. And part of the process also is to destigmatize psychiatric illnesses and treat them more like physical illnesses. Everyone is deserving of care and help and compassion, and there's still a lot of stigma about mental health. So part of my goal with 988 is just to make it more friendly, available, kind of in your face, so to speak. This is for you to know about. Kids should know about. Schools should advertise. 988 should really become part of our culture.
And my final question, your take-home messages that you want to leave with the KevinMD audience.
Take-home message is mental health is incredibly important. It is a huge problem in our nation. We need to do better. And I want everyone to know about 988, learn about it, tell your friends, your family, if you're a physician, put a poster up in your office so we can educate people about 988 and save some lives.
Rich, thanks again for coming back on the show, sharing your time and insight.
Thanks, Kevin. Always a pleasure.